As Joey said, I'm Ivey Wholfeld, and I'm a program manager for the Engagement Awards team at PCORI. And today I'll be sharing a bit about PCORI. I'm going to go over what we mean by engagement. I'll talk about the Engagement Awards program that I work on, and then I'll share about how PCORI engagement awardees are addressing the pandemic and some of their virtual engagement tips. So now a bit about PCORI. As we know, traditional health research, for all of the remarkable advances it produces, it hasn't been able to answer many of the questions that clinicians and patients face daily. And so the PatientCentered Outcomes Research Institute, or PCORI, was authorized by Congress in 2010 to close that gap. And we were recently reauthorized for another 10 years in 2019. PCORI has a 21-member board of governors representing the entire healthcare community. Our mandate is to improve the quality and relevance of evidence available to help patients, caregivers, clinicians, employers, insurers, and policymakers to make better informed healthcare decisions. PCORI funds comparative clinical effectiveness research, or CER, and that engages patients, caregivers, and other stakeholders throughout the entire research process. We focus on answering questions most important to patients and those who care for them, and we aim to produce evidence that can be easily applied to real-world settings. So this slide just shares all of the many stakeholders that we involve in our work at PCORI. So what is engagement in research? It's stakeholders meaningfully involved throughout the entire research process, from planning a study to conducting a study through disseminating the study results. And PCORI has 4 engagement principles which guide stakeholder engagement process. There are reciprocal relationships, co-learning, partnerships, transparency, honesty, and trust. And so let's talk about how we engage. And there are a variety of ways and approaches to engage stakeholder partners in research. Stakeholders can serve on an ad hoc work group to help prioritize research questions or develop dissemination strategies, or they could have more sustained involvement in a project, providing input and guidance by serving on an advisory council or committee, or they can serve as a co-investigator or project partner. And much like the approaches, there's variability with respect to the level or intensity to which partners are engaged. And this image, it shows how stakeholders are involved in every step of the way, in the beginning stages, from relationship building and skill building, all the way through sharing and encouraging the uptake of findings. And meaningful engagement throughout the entire research process is what makes PCOR and PCORI so different. So, as you've heard by now, engagement is integral to our work and the work that PCORI funds. And so the Engagement Awards program was designed specifically and intentionally to foster engagement and build the capacity for stakeholders to be able to participate as partners in PCOR and CER, and to serve as channels to disseminate PCORI-funded study results. You'll note that the Engagement Awards provides funding to support engagement in and with research. We don't fund the actual conduct of research. And since our program launched in 2014, we've awarded about $112 million to support 546 projects. And as seen by this map, we're building a large national network of stakeholders participating in PCOR and CER. So last year, we introduced 2 funding announcements to address COVID-19, an enhancement to existing PCORI-funded engagement awards, and a special cycle to support engagement and dissemination of PCOR and CER in the context of COVID-19. The enhancements were required to do one of the following: use an existing engagement awards project infrastructure to build capacity to conduct engagement in PCOR and CER through alternative mechanisms in a time of social distancing and isolation, or enhance an engagement award project's effort to increase patient and stakeholder communities' understanding of PCOR and CER around COVID-19, or leverage existing engagement infrastructure to expand upon the aims and objectives to be specifically responsive to the COVID-19 pandemic. And for the special cycle, projects had to propose that they could help communities increase their capacity to participate in all phases of PCOR and CER while responding to contextual changes as a result of the COVID-19 pandemic. So these projects focused on identifying and using effective methods for engagement to build knowledge, competencies, and abilities for their community to be meaningful partners in research, but in a virtual environment. So 44% of the enhancement awards are using at least one or more virtual tool, and 88% of the special cycle awards are using one or more virtual tool. Most are using some form of virtual meetings like conference calls, webinars, and workshops. And many are using tools to address accessibility for virtual collaboration, or are looking to figure out how to engage virtually with a specific population. On this slide, I'm going to share some key takeaways from our awardees on how to engage virtually. A lot of groups are using social media not only to promote and share their project, but they're using it to keep in touch. So like apps like WhatsApp, they're having group text chains and individual check-ins, and it's creating those channels for feedback and promoting that ongoing engagement in between meetings. And even though we're not meeting in person, we're still able to share a meal and break bread virtually. And so folks are using apps like Grubhub and DoorDash, or they're working with a local restaurant to deliver healthy or not so healthy meals to share while they're having the meeting. I've heard of early morning meetings even having coffee delivered. Sending a care package, like a virtual swag bag with meeting materials, or even sending like quiet time toys to replace on-site babysitters have also been used. Being very flexible, especially with scheduling and access. And so with regards to scheduling, folks are hosting meetings at night and on the weekends. I know Joey was having to do this himself. Or they're breaking up an all-day in-person meeting into a series of shorter virtual meetings. And instead of large focus groups, people are having to do one-on-one individual interviews. Also to address access, I know folks instead are conducting surveys over the phone or sending them in the mail. They're mailing or they're dropping off slides and meeting materials for those who might be calling into a meeting and may not be, participating on Zoom on the camera. Awardees are organizing virtual talent shows and other performances to have that informal fun that you would have, at an in-person meeting. And they're using diverse platforms. So a multimodal approach using screen sharing and whiteboards, chats and polls, breakout rooms, all of these allow for participants to be engaged in different ways that are, let them feel comfortable to share their ideas and feel like they're being heard. And it's important to have champions on each project team who are responsible for checking in with individuals to make sure that everyone is feeling like they're heard and there's opportunities for that ongoing feedback. This slide highlights a project in Baltimore that's engaging a cohort of 20 community partners who reported a low level of digital literacy, and they're working to increase their skills and abilities to participate as meaningful partners in research in a virtual environment. And this project is collaborating with some unique stakeholders, including the Mayor's Office of Digital Equity, as well as Comcast. Here's my contact information. So thanks, everyone.